Hello. After the extraction, patient should bite on the gauze for 30 minutes without talking, spitting. After 30 minutes, you can wash your hands with soap and water and get a new gauze folded and put it in place and bite on it for another 30 minutes. In the meantime, you can use a cold pack on the cheek of the affected area. 10 minutes on, 10 minutes off. If after these 30 minutes still you feel like you are bleeding, you can get a tea bag, wet it and put it in the place of the extraction and bite on it for another 30 minutes. The tannic acid in the tea bag helps the clot formation. For the next 72 hours, avoid extraneous exercises as this causes bleeding. Avoid drinking alcohol as this delays the healing. And avoid smoking and drinking through a straw as these would cause a negative pressure in the area and would yield to dry socket, a very painful condition. When laying down, keep the head higher than the heart so that would decrease the pressure inside the mouth and decreases the bleeding. Drink lots of liquid, eat soft food, and food rich in protein that would help healing the area. A lot of people call and say they are bleeding, whereas as the saliva passes through the newly formed clot, it changes color to a pinkish color, and patients think that it's bleeding. It's not bleeding. It can go on for a few days. Active bleeding is when you open your mouth and you see blood coming out of the socket, or within few minutes your mouth gets full of blood. In case of fever or excessive bleeding or any other complication, call the office. Take your medicine on time, and hopefully you would feel better soon. Thank you.